Hello, so today I will be doing a patient teach back video for someone who has just been diagnosed with type 2 diabetes and for someone who has just been prescribed to take metformin daily for their type 2 diabetes. I would do some patient education, and I would also go through and teach them how to do a blood glucose stick and to monitor their blood sugar. But the first part, I will be going over the patient education for metformin. So metformin is used to treat your type 2 diabetes. It controls your blood sugar by decreasing the amount of glucose your body absorbs and also decreasing the amount of glucose produced in your liver. It also increases your body's response to your own natural insulin. Along with taking metformin, you should make some healthy lifestyle changes, including eating a healthy, balanced diet, exercising regularly, staying hydrated, and quitting smoking if you do smoke. So some important information about metformin that the patient should know is that you should take your metformin at the same time every day, and that your doctor may start you on a lower dose and increase your dosage depending on how your body reacts to the medication. You will need to monitor your blood sugar carefully and report your findings to your doctor, and I will instruct you how to do that in just a few minutes. Some important instructions for taking this medication are to take it every day, even if you do not feel well. Something interesting about the body is when that you are sick, your body actually reacts to that by increasing your blood sugar, and that spike in blood sugar needs to be counteracted by regular levels of metformin that you have in your body throughout the day. So you will still need to take your medication even if you don't feel well and you don't plan on eating much during the day, because your body will spike your blood sugar if you are feeling sick, and you would need to counteract that with the medication that you are taking. You would also need to contact your doctor if you have any signs of serious infection or develop any severe vomiting, diarrhea, or fever. Make sure you are well hydrated on this medication. We recommend that you drink at least 8 glasses of water a day. And to notify your doctor or dentist if you are on metformin and going for any procedure, they will you will notify the doctor, and they will alter the procedure accordingly, just to make sure that we are taking your type 2 diabetes into account. If you are going for any procedure that uses contrast dye, such as an X-ray or a CT scan, you will need to notify your doctor of that as well. You will need to stop taking your metformin for around 48 hours before and after the procedure, and that's for kidney and liver protection. So some more information about metformin that you should know is that you should ask your doctor how much alcohol you should be able to take while on this medication. You should not drink heavily or binge drink while on this medication, because it could cause a bad reaction, and it could cause your blood sugar levels to spike or lower depending on how your body reacts. You should also not binge drink, because you could develop a complication called lactic acidosis. If you experience any extreme fatigue, nausea, vomiting, stomach pain, or rapid irregular heartbeat, any shallow breathing or shortness of breath, or any muscle pain or cold feeling in your hands and feet, you should notify your doctor right away, and also let them know that you are taking metformin. Your doctor will also order lab testing during and usually in the beginning of your treatment to monitor your kidney function while on metformin. And you should make sure that you keep these lab appointments just so that you are up to date and that you have everything that you need while you are on this medication. So for blood sugar testing, I will instruct you how to do that now. So what you would do is you would clean your finger using an alcohol wipe. And then once your finger is clean, you would prick your finger using the testing device and gather a small drop of blood. You would place that drop of blood on the monitor strip. Make sure that the blood goes all the way down the monitor strip, and that the device recognizes that the blood is there, so it can begin the process of giving you a blood sugar back. You would wait for the results of the blood glucose monitor, and just so you know, a healthy blood sugar level varies for type 2 diabetic patients, but it's around 100 to 140. So I would teach the patient how to do that, and then I would also have them go through and do a blood sugar test on themselves. I would make sure to watch them to see that they prick their finger correctly, that they put the drop of blood on the strip correctly, that they get a correct reading, and that they clean the blood off using a piece of gauze to make sure that, you know, they're not bleeding out, even though they want it from a little stick of blood. It's just important to have them know that to stop the bleeding. and to also make sure that they are preventing infection. All right, thanks. Bye.